When I was voted president of the Medical Society, I have two projects in mind. One is to establish a scholarship, and the other one is to have a medical surgical mission.
We have seen at least about a total of 200,000 patients in the last 29 years.
The medical mission in itself is very, very important. It helps people who are in need of medical help. Lots of those people who travel from lots of faraway places have traveled sometimes 3 to 4 days just to get to our medical mission area. And lots of these people have not seen doctors in their own lives at all.
There are now about 150 to 200 members, including nurses and support group.
Despite the fact that I leave my family at times, my practice, giving that services to my own people is something that really gives me the impetus to help.
We offered all these services in the medical clinic, and the physical examination, treating and diagnosing diseases, eye examination, surgical consultations, and referring surgical patients to our full-time surgery staff in the hospital.
Many people that we saw here in the Philippines were people who I wouldn't really expect to see here in the States if I were practicing as a physician. So that opened my eyes to the inadequate healthcare systems within developing nations.
There are many who really stand out, but our star patient is a very nice lady by the name of Benjamina. She is a 29 years old lady who has a very severe kind of elephantiasis. Means there's one of the leg is very swollen, that it's practically dead, and no one wants to touch her. She says it's a very difficult patient. There will be a lot of complications when they operate on her. It took them several hours to confer, and they said that I think they can help the lady. There was a prosthetic specialist who donated the 15,000 to 20,000 cost of the prosthesis. After it's all done, she looks like she's never had an amputation. When was just ready to go home, we had a party for her. She danced most of us. She was and it was a very nice, successful mission.
It's really hard to communicate to everyone that didn't go on the mission, you know, the type of impact that you get from the mission. That experience is one of a kind, unique, that you only really get when you go on the mission. The interactions you make with the patients, the stories that you hear, that's what makes me want to come back every year.
The greatest reward is, as a surgeon, after you operated them, like somebody who has a big hernia, and if you fix them, they can be able to do some work in the farm, or do their work so they can support their family.
For some reason, we keep on saying, no more, this is it, but come a month after we finished with the mission, we're back working and looking for funding and doing all kinds of different ways to make it more successful.
I always encourage physicians to at least once in their life, they should attend the medical mission and help the medically indigent people in the Philippines. It's so rewarding that, especially when you see all of them bidding goodbye to you with all their encouraging smiles, you know, it's really worth it.
I invite you to participate and support our organization through your donations, prayers, or by becoming a member or volunteer. Come and join us. Thank you very much.